please provide an overview of the United Nations Development Program? 国連開発計画はどのような団体ですか？
Who I am. I'm Mandeep Dhaliwal, and I lead the health program at UNDP. The United Nations Development Program is the development agency of the UN system. We work in over 170 countries, supporting countries to reduce inequalities, address challenges like the climate crisis, health crises, and to build resilient systems for sustaining their development progress. So we work in close partnership with partners like GHIT, other WHO, UNICEF, other UN partners, the Global Fund to fight AIDS, TB, and malaria, to help countries in their fight against pandemics like AIDS, TB, malaria, neglected tropical diseases. We work in 3 areas. One is around reducing inequalities that drive disease. The second is around improving governance for health. And the third is around building resilient and sustainable systems for health. And we do this by working with our partners to strengthen the policies, the institutions, and the capacities that are needed to drive better health outcomes.
Are there any challenges you are facing in your global health efforts? グローバルヘルスにおける取り組みで直面している課題があれば教えてください。
So our work on health covers about 140 countries. Across these countries, we have seen major challenges on health relating to widening inequalities. Inequalities both in access to health technologies and innovations, but also inequalities in terms of access to services and increasing risk and vulnerability for people to poor health. Secondly, we look at addressing how we can make communities and people more resilient to crises like pandemics, zoonotic spillover, antimicrobial resistance, climate crisis, all of these intersecting with economic crises and political crises to make people more vulnerable to health. So there's also a need for greater innovation for health technologies in low and middle income countries. So when there are tools and technologies for people to be able to access them so that we don't leave people behind.
Please tell us about UNDP's collaboration with GHIT. GHIT と UNDP はどのような取り組みを協業していますか？
We're very excited about the collaboration with GHIT. It's a really important collaboration in that we bring together GHIT's expertise in funding innovative partnerships for the development of new health technologies for TB, malaria, neglected tropical diseases, all very important, and how we prepare the ground together with GHIT to make sure that once we have new health technologies, we're able to get them to people in need as quickly as possible. And we do that through strengthening systems at the country level, strengthening health procurement, for example, strengthening policies and systems for introduction of new technologies, removing regulatory barriers, all critical to reducing that time period from when a technology becomes available to when we actually get it to patients.
Do you have any messages to global health partners in Japan? 日本のグローバルヘルスのパートナーに向けてメッセージがあればお聞かせください。
We really need Japan, especially in today's world, to continue their deep and long-standing leadership on global health, on issues like innovation, universal health coverage, health security, human security, vital. The kind of world that we're living in, if we want to accelerate progress, we have to innovate even more. I think multilateralism is key to achieving the kind of scale and equity that we need today in global health. And Japan has been a long-standing supporter of multilateralism, and we look forward to their continued leadership.
GHIT Fund. Fight neglected diseases through partnerships.